So my name's Kathryn Whitmarsh. I'm an occupational therapist, currently working on a secondment as a project manager, which is something very new and exciting for me. I've come a very long way, probably from when I first started, and I just worked that out today, 35 years ago, as what they used to call an OT helper in those days, which was cringeworthy even at the time. Through several years of that, through going back to university and training, and through a long career, through many different opportunities, a lot of them here in Salisbury, and to where I am now, which is based in the Spinal Injuries Unit in the Salisbury site, and managing this project to improve the services across the whole of the southwest region. I was a young mum sitting at home, having not done much with her life up to that point, and I saw a part-time job in the local paper, thought, oh, that's quite interesting, perhaps I'll try that. It was only for 3 months, and here I am 35 years later. Things have changed enormously, obviously professionally and sort of clinically. I think maybe some of the biggest changes are organisationally, and I think we've experienced that as therapists at different levels at different times. I've been so privileged to be part of quite a select body of therapists working in this area, and you're always learning, there's always something different, and we're at the moment working on some really big stuff nationally and regionally to try and improve services to all spinal cord injury patients across the whole of England, and particularly across the southwest. And that for me is a new thing and a really exciting thing, a bit of a departure from the clinical roles that I've always had in the past, although I've been obviously gradually moving into leadership roles within therapy over the last 10 years or so really. But this, to take a step away from the clinical, is a bit of a step into the unknown for me, but a really exciting one, and a chance to use everything that I learned and believe in as an OT on a bigger stage and to affect more people.
Hello, my name's Clare Lewis and I'm one of the dietitians, and I've been working in Salisbury Hospital for 21 years. I came into dietetics a bit by default, as initially I'd wanted to do medicine, but then I developed glandular fever during my A-levels, followed by chronic fatigue, and decided to take a different career path. But I've never looked back. I've always found nutrition absolutely fascinating, and luckily I still do. Often when people find out that I'm a dietitian, particularly non-medical people, they think I spend the entire time just giving diets to people who are overweight, but that couldn't be further from the truth. Dietitians spend their time helping people achieve good nutritional status by addressing problems such as intestinal failure, the inability to swallow, disorders of metabolism, be they inherited or acquired, malabsorption issues, mental health issues, as well as poor appetite. And at any one time, probably about 20% of patients in Salisbury Hospital are under the dietitians. There have been many changes in dietetics over the last 21 years, but I think that probably the most important thing has been the increase in profile of nutrition, of nutrition generally. And I think both surgical and medical teams alike realise that in order to get the best possible outcomes from their patients, those patients need good nutrition, and this obviously also helps with reducing length of stay. Dietetics is an extremely rewarding career, and it will be fascinating to see what dietitians are in fact doing in the next 20 years. I think one big area which I think is going to develop, and dietitians will be doing a lot with, is the prescription of both pre and probiotics for improving gut health. But watch this space, I'll be interested to see what happens.
Hi, so my name's Gillian Hibberd. I'm one of the Band 7 physiotherapists here in the hospital. At present, I'm working in the older persons therapy team. So I worked doing this job for a couple of years. Well, I did an A-level because I didn't have any A-levels. And then I went to Southampton University and qualified as a physio when I was 36. So I'm now I'm retiring at the end of this year, and I will have done 22 years of service. I really enjoy it. It's fun. I've had good days and bad days over the years, which we've all had. But what physio is never boring. So every day you just have no idea what is going to be thrown at you. And I've had the opportunity to work with really lovely people. I've found Salisbury a great place to work, and I've had lots of opportunities to develop my career. I had spells of doing some management work. I wrote a big review paper. I've done a secondment into the community. Lots and lots of different opportunities, and now kind of in the last few months of my career I'm looking at what I might do once I retire at the end of December.
So my name is Ginette Phippen. I'm a speech and language therapist. I've been qualified since 1989. I've worked in lots of different areas, but I've been here in Salisbury since 2002, which feels like a very long time, but means that I feel very comfortable working here. It's a very happy and fulfilling place to work. The reason I'm still here in Salisbury and the reason I'm still working in the job that I've done for the last over 20 years is because it's so varied and so interesting. So I've always had an interest in working with other professions. So I've always really been attracted to multidisciplinary working. I have worked in community clinics, I have worked in schools, but that's always been alongside other people, health visitors, teachers, and here it's alongside consultants, in orthodontics, in plastic surgery, in all sorts of areas, dental, audiology, and that's what makes it really fascinating. We have a regional centre here in Salisbury for cleft palate care, and the opportunities that presents for really working, being involved in research, service development, and the day-to-day work. There's nothing quite as special, even when it's over a video call, of sitting with a child of 18 months and helping them to develop their communication. And even during the last year and a half, when we've done a lot of that through telehealth, that's been incredibly satisfying and rewarding.
My name's Kathryn Harris. I'm qualified 33 years. Trained in London and went to work in various places, including the United States, before coming to work in Salisbury in '94. My current job here is Respiratory Specialist Physio on the Spinal unit here, the Spinal Centre. So I'm sort of really involved with any spinal cord injured patients who are having any problems with their breathing, need to be on a ventilator with a tracheostomy. I was always aware of physios and what they do because my mother's physio, so that was a sort of something that I always knew about. I certainly sort of went to work with her a few times before I then did more formal work experience, and I was attracted to the autonomy of the role and the fact that you sort of get to make a few more decisions for yourself in terms of being a professional from that point of view. I just really enjoy being an expert in my field. I've done it for a very long time, and I think I've still got a lot to offer in terms of particularly training to try and contribute to what's quite a small field within a specialist area, to contribute to really good care for the sort of very high level spinal cord injured patients who need to sometimes leave hospital living life on a ventilator, and that's quite a big operation to pull off at the end of the day, and it doesn't happen every week or every year, 6 months even. In some cases it can be quite a long, slow process, but to actually achieve someone making it out of hospital and it being a safe discharge for them to be living life in the community and finding some quality, that's really worthwhile. I find that very rewarding.
So my name is Lisa Hirst. I'm a speech and language therapist, and my job here at Salisbury is as head of service. I've been here in Salisbury for nearly 24 years, and I've been a speech and language therapist for over 30 years. So my journey in speech therapy is I qualified in Leeds back in the late 1980s with my degree in speech therapy. And then I had several jobs in Newcastle upon Tyne, working in the community with children as well as in the community with adults, and then in a big teaching hospital. And I was lucky enough there to start on some research, and that ended in me getting my PhD with Newcastle University. in the area of swallowing. Then I moved to Salisbury and I've been here ever since. One of the lovely things about working here in Salisbury is that we are working both in the community and in the hospital, whether that's inpatients or outpatients. And with our cleft lip and palate service, that's a regional service as well out in the community for their outreach. I was drawn to speech therapy because of the huge variety in terms of ages and the types of speech and language and communication disorders, but also particularly because it was quite autonomous in the work that we do and quite unique. It's an area that nobody else knows anything about, and it's actually very detailed and very interesting and quite exciting. I feel like we've come a long way. I think the service has changed beyond recognition in the last 20 years here in Salisbury, and we've embraced new techniques. We've increased the amount of staff. We have a regional remit for cleft lip and palate. We're much more instrumental, but I feel there's an awful lot further to go, and the difference we can make to people's lives is quite staggering, and we just need to be keeping at the forefront of technology, but more importantly having the resources to use that for more patients more of the time.
So I'm Lorraine Bartin. I am a diabetes specialist podiatrist. I run and lead the diabetic foot service for inpatient and outpatient. I've been qualified 37 years and I've worked in diabetes here at this hospital for 21 years. So my role is very specific in that it is diabetes only, with vascular complications, with wounds, infection, gangrene, amputations. And I work with two fantastic teams, diabetes and vascular. In 37 years, a huge amount of changes and a lot more opportunities. So for myself, for example, I've managed to be able to carve a niche role in a specialty which 37 years ago didn't really exist. You were very much a general practitioner. Whereas these days, a podiatrist can specialise in musculoskeletal, high-risk foot areas. You know, the opportunities are much greater. I'm still doing this role because all of these years I've managed to continue to do training courses. I've done more education. I've been a lifelong learner. You've probably heard that phrase, but I genuinely have. I've done many courses. I've been back to university. I've specialised. I've just kept moving forward so that I'm at the forward edge of this profession, and I've enjoyed every minute of doing that, developing, learning, and I'm still doing that. I learn from my colleagues. My practice is improving all the time. I've just kept going.
Hi, so my name's Sue. I'm one of the orthoptists here at Salisbury Hospital. We're a small group of 3. We work in the eye clinic. I graduated in 1995 from Liverpool University, had numerous jobs around the northwest, a little bit in New Zealand, and then I actually joined Salisbury in 2002, so coming up for 20 years now. I've been working at the Trust. So the profession's changed massively since I joined. It was very much centred on doing pure orthoptics, which is seeing anyone with visual development problems using the 2 eyes together, binocular problems or eye movement problems, and that's still a big chunk of what we do. But since then we've expanded massively, so now orthoptists are involved. I mean, just here at Salisbury we're not a huge trust, but we get involved in various different areas of ophthalmology, so you can subspecialise. We've got orthoptists working in the macular service and doing injections into the eye, seeing cataracts pre-op, post-op. You've got opportunities to get involved in glaucoma, so it's just expanded massively from the traditional area that was, you know, orthoptics, nurses, doctors. Actually, we're doing a lot of the roles that would previously been done by junior doctors, so a lot of extended scope practice, which is great because it just gives us so much scope to extend, and I think that's just going to keep going as we keep expanding.
Hi, my name's Stacey, the Chief Exec of Salisbury Hospital. I wanted to speak with you today to help celebrate the work of our allied health professionals. I know they have their annual Day of Recognition on the 14th of October, and it's a really good opportunity for me to thank all of the people that work as part of our teams at Salisbury Hospital. They do some amazing, fantastic, dedicated work for our population, and I anticipate going forward that they'll be really instrumental in helping us deliver our strategy and how we can start to improve the offer that we make for our local population. Therapists have very unique opportunities to form very special bonds with patients, and I think they are really well placed to help us make those changes. I hope they have a brilliant day on the 14th. They're special to us each and every day, but it is time to kind of pause and take stock of everything that they do, and I'm really proud of everything that they achieve for us.